Hello, my name is Rupam and today I am in Nandadeep Eye Hospital, which is a group of super specialty eye hospitals in Maharashtra and Karnataka. They are also optometry and ophthalmic training institutes across Maharashtra and Karnataka. So today I am in conversation with Dr. Saurabh Patwardhan, who is the practicing ophthalmologist in Nandadeep Eye Hospital. He holds the prestigious FRCS or the Fellow of Royal College of Surgeon, and he has practiced in AIMS before providing his expert services in Nandadeep Eye Hospital. Thank you, Dr. Saurabh, for joining us and having this conversation with us. Thank you, Dr. Saurabh, for taking time from your busy schedule for this podcast. Really appreciate your time.
Thank you.
And as you see, I have a list of questions to ask you.
Yeah.
So let me start with one of the questions which I always wanted to ask, because you have practiced in so many places in India and you are running a flourishing practice over here in Nandadeep. Do you think that as Indians, we know the importance of periodic eye checkup, or do you only come when you have problem in your practice?
Yeah. So surprisingly, and I would say not surprisingly, because now we have seen so many patients, not just patients, even doctors, who don't come for regular eye checkup. Okay, that is because I feel as ourselves, we take health as a granted subject. So unless we have some issue, that means we have some problem in our day-to-day activities, we don't think about a regular checkup. In that matter, about even the systemic checkup, blood tests and everything. And same goes with eye checkup as well, where even for eye checkup, unless the I cannot see clearly, or I have certain issues while focusing on objects, or I have some difficulties, maybe I am seeing some spots, I am having headache, then only I will go to eye doctor to get it checked. Okay, and which should not be done. It should be an annual checkup, because there are so many hidden diseases, okay, so which come to us as we age. If they are picked up at right time, we can treat them in a better manner to have a long term good effect on your visual health. And not just us, as adults, because adults at least have the the, or I would say, the responsibility to get his or her eye check regularly. What about our children? We are not getting them checked as well. Okay, while children, as you know, they will not complain about any problem whatsoever. They are so adaptive to many issues. So we see many children who have got refractive errors, less vision, but they will never complain to their parents, and when they are not checked regularly, we miss the problem when it can be treated much easily and we face a bigger problem. So I feel, as Indians, I think we should, at least from New Year, we should make a resolution that one day at least in a year we should dedicate for a good eye checkup, because vision is something we depend on most of our even work as well as in personal life. We depend on our vision the most.
Thank you, sir, for that answer. That's very enlightening. That at least once a year, whatever is our age, we should get our eye tested. And many a times, sir, what I have seen is that people don't know when to take their kids for an eye test.
Yes.
And the kid is in the school and they're struggling, and somebody comes for an eye camp in the school, then the parents discover.
Correct.
So, is there a guideline for kids to get their eye tested as well?
Yes. So there is a very good guideline by WHO for getting children tested, because as I said, the best time to detect a child having an eye problem is actually within first 5 years of life. Yeah, which is actually what we call is preschool. So as you rightly said, we do a lot of school screening camps, even our hospital and our foundation does, and we detect so many eye problems in that. But it is still late for that child, though we are detecting it at 7, 8 years of age, which is still good, we can treat it, it's still late. So if parents are aware, they will get the first eye checkup done within first year of life, then third year of life, and then fifth year of life. So basically, the first birthday, third birthday, and fifth birthday should have one dedicated day or dedicated time for regular eye checkup. And for particularly premature babies, of course, this the pediatrician will inform you, or neonatologist will inform you, that premature babies need to be checked within first 30 days of life, because they have a disease called retinopathy of prematurity, which is a potentially blinding disease, and it cannot be detected by just shining a torchlight. It has to be properly checked in order to see if the child has it, and it has to be treated immediately. So I think that is very important, that if child is premature within 30 days of life, within first year for normal babies, and then third birthday and fifth birthday. I think that should be remembered by us.
That's so grown-ups takes it once a year, but for kids, if it's a premature, they take it at around 6 months of
No, first
six,
is 30
30
days,
days.
within 30 days,
30
first
days.
30 days. Yeah.
First 30 days, then 6 months, 1 year, third year, and fifth
Fifth
year.
year, yes.
And after that, every year,
Every year.
like the parents.
Yeah.
So back to school should be also a eye test along with all the
Yes.
new books and the dresses we buy.
Yes. So I think it's a good appeal to even school authorities. They should also think that they should collaborate with some eye clinics, or there are many foundations who are working on that. That they should arrange a school screening for all their school their students every year.
And that's great. And as we are speaking about kids, let me ask you a few more questions on kids.
Yes.
We keep on hearing a term called as myopia nowadays.
Yeah.
The social media is flooded with it. Most of the time when you walk to hospitals, there is this communication on myopia. And you have 3 myopia clinics that I learnt of from you.
Yeah.
So what is this myopia and why are we talking about it? Is it really dangerous? What happens to a kid with myopia?
Yeah. So if you remember our school days, probably we would have a class of say 50 or 60 students, and I would remember that maybe 1, 2 or 3 kids will be having specs, yes. Right? Now you go to school, any school, you will find that almost 20, sometimes 30% of children are wearing specs, or they might be having specs which are not detected, okay, which is a huge problem. So last 30 years that has been exponential rise in children requiring these specs, and usually these specs are minus specs, okay. So minus specs we call in medical terms as myopia. So
okay.
that's why we are talking about this myopia, and this is something which has been already detected elsewhere, like in Southeast Asia. There has been rapid increase in the myopia for last several years, and now in India also last several years we are seeing that more and more children require spectacles for distance vision, which we call as myopia.
So basically myopia is something where the kid will not be able to see the distance.
Correct.
But they will be able to do anything which is near to them.
Most of them can do near activities. That's the thing. Yeah.
And like if the kid has myopia, what do we suggest to them? We suggest them various treatments, right? There are treatments for that.
Yes.
Does it increase? Or?
Yeah. You asked me something whether it is dangerous,
yes,
or not. Yeah. So I know few parents are very anxious when they come to us and the child is not able to see the blackboard. That's the usual complaint, that in school they are not paying attention, and then the school teacher tells, yeah, maybe your child has some problem with the eyes, or they get screened in school screening and they get this problem so detected. And when they come to it, they are very anxious that what has happened to my child, is it a big problem or something. So once we thoroughly examine the child and we find out that the child has a minus refractive error, which is a myopia, there is nothing to be worried so much about that child is going to lose vision or something like that. Yes, but there are few things which the parents must understand, which are the facts. So first thing, the child will require spectacles to see distance vision or clearly everywhere. So that is not something which we can just treat or cure at that point immediately. Okay, for treatment we have to give spectacles for that child. That is one thing. It has to be accepted by the parents as well. They should not keep any anxiety or what will happen to my child, will he get addicted to spectacles. That is also sometimes they have this myth that if we give spectacles he has to wear it for lifelong or something. I would say that is the minor problem. At first, for children, the most important thing is vision. The child should be able to see clearly everything, because that is something is going to help his growth, whether it is academic, physical and everything. And having spectacles is not a problem. But coming to why it is, why we talk about it more and more, is because of the myopia progression. That means this number is not something which is static. That means suppose my child is say 7 years old and the child gets a spectacle power of -2. Okay, fine. With -2 the child is seeing very clearly, read the chart, everything, school no problem, school work, everything the child can do. But this is not going to be stable. This is going to increase as the child grows. Okay, and that is something we are worried about. Okay, now why we are worried about? It's just a number, right? -2 goes to -3, -5, -6. That's fine. I am wearing specs anyway. I will wear a different spec, right? But that is not like that. The problem is that the change in the myopia also means change in the anatomy of the eye. Okay, because more the myopic spectacles the child has to wear, that means the eye has grown more. So eye has become longer. Okay, longer the eye, okay, there will be some changes in the posterior segment or the area behind the lens, which we call it retina. And these changes, if they are much higher, say the child starts getting -6 and above refractive errors, we call it as high myopia or sometimes pathological myopia. That means now the myopia is associated with some retinal weaknesses. There can be some holes or breaks in the future. There will be vitreous degeneration. So there can be a chance of higher chance of retinal detachment in future. Also it may affect the visual quality as well as the number grows higher and higher. So as doctors, we want it not to progress further. So child has got myopia, that's fine, but let's try to halt its progression so it remains within a limit. So it doesn't go to high myopia or pathological myopia. So long term child's vision or visual quality is not affected.
So you are saying that if we bring a child with a myopia management in your clinic,
Yes.
then the idea is we're also investing on the child's future, that the future is much more safe and secure in terms of eye health.
Exactly, that's the point. Because if we have to intervene, this is the age at which we should intervene. If child comes, he grows and he comes at 18 years of age, already the growth has happened. So now we are not going to stop any further progression. But if the child is say 6-year-old, 8-year-old, 10-year-old, 14-year-old, we can still stop the progression at least further till the time the child reaches 18 or 19 years of age. Right?
So from that birth, like you said, the guidelines, till 18 years is a very crucial period
Very
for us.
crucial, yes.
And till 5 at least they should have 3 eye checkups.
Yes.
And after 5 at least 1 eye checkup every single year to avoid all of these problems.
Yes.
One more thing that you told me is that when we were kids, there was only a couple of students with the minus number, and now we are seeing almost 20-30 students in a class with the minus number.
Right.
Can this be avoided? Can we prevent this from coming into our eyes?
Yeah. So the answer is probably yes and no. Okay. Both.
Okay.
Okay. So why? I would first tell you how we can prevent it. Okay, and why it is happening more and more. Why the incidence has increased. The first reason is of course that our outdoor activities, particularly our children, their outdoor activities have reduced drastically. We are more focused now, probably our children are more focused on indoor games or academics. Okay, so earlier we used to play a lot in sunlight, and as per the studies as well, what is suggested is that every day if 30 to 45 minutes of outdoor play under the sunlight is done by children, then the chances of myopia are less. Okay, so that is first thing we should remember. So indoor games are not that helpful in terms of reducing the chances of child getting myopia. Second thing is that the use of screens. The children get addicted to various devices like mobiles, tablets, desktops, and all this promote more and more of near activities and reduction in the outdoor activities, because they lose interest in the outdoor games. They are more focused on indoor games or the screen related activities. So that is obviously going to increase the myopia. Okay. Third thing is of course the general health. Okay. I think you recently mentioned to me that if the younger children, if they daily do 30 minutes of good physical activity, it means good physical health, and that also means the chances of myopia are less in these children. So I think if as you said, can we prevent it? Yes, these are the ways we can stop our children getting myopia. Okay, but I would say no in terms that not all myopia are because of lack of outdoor activities. Okay, there might be some genetic component to it as well. So some children are likely to get myopia irrespective of whether they take all the precautions. And of course in no, because we can't force children to stop the academics as well. That is also become a part of our life, at least as on today,
Oh, yes.
unless the educational system probably changes in next decade or so. So they have to study, they have to do the, and nowadays we are dependent on screens. So I would say we cannot 100% eliminate it, but at least we can try to reduce the chances of getting myopia.
So the chances of reducing myopia, like you said, is to go out,
Yes.
get real friends, and use the power of sun to prevent, or at least try to prevent getting myopic in your eyes.
Yes.
Any diet you suggest for these kids?
A good healthy diet. So there are sometimes there are myths like you eat more carrots, you eat these and that, and it just that's not going to happen really. But yeah, a good balanced diet is something is recommended, not just for eye health, it is for general health, and because eyes are part of your body. So if your child is healthy and you are having healthy habits, it's going to of course prevent the eye related problems as well.
And do you want to tell something to the parents about their lifestyle change as well to impact the child?
Yeah, of course. So children tend to mimic, or they see parents using the screens and other things a lot, and maybe spending time with them is also reduced. So probably that if the parents can change those things, also involve children more outdoor activities, so that will also help our children.
So, and when we were discussing about myopia and its treatment, you said that the kid has to wear a glasses if they become myopic.
Yes.
And then there are some special glasses that are now available. I was seeing that in your clinic as well.
You're right.
So, how does these glasses work? Like, do they really work first, and how?
Yes. So since myopia is increasing now, of course, a lot of research is going on in order to reduce the progression, as we said. And one of the first treatment that I think probably came out was use of a low dose atropine drops, which was established by a multi-centric trial that it prevents the progression by 50% when we use it in right patient at right time. So that was the first intervention which was done, and we are using that quite often in the children. Now, in order to further reduce the progression, there have been more studies going into use of special specs. So we call them as myopia, myopia specific spectacles, which add a additional, I would say, a measure apart from the medicine that we are giving to reduce the strain on the eyes. There are certain principles on which it works, like there is a peripheral defocus, in order to reduce this myopia progression. So we have been using it for last probably 2-3 years in patients, and we are seeing good results of it. The acceptance by the children is quite good. So they do not see any difference in terms of doing their regular activities from the conventional spectacle. So they can do everything what they can do with a conventional spec, but additionally they have a advantage that the myopia progression also will be slowed down or halted using these specs.
And so they can wear a normal specs as well, where they will be able to see, but that will not be able to slow down their power progression.
Yes.
But these specs can slow down the power progression.
Correct.
Are these very expensive, or like they're okay?
Yeah, so they are probably more expensive than the conventional specs which are available. But nowadays, because many companies are now trying to produce these spectacles, and they can be available at a reasonable price. And I would say, considering the long-term effects of high myopia, which is going to have over a entire life of that child, I would say it's still better to use them rather than avoid it only for the cost reason.
Yeah. Because then we'll be able to prevent all of those diseases at the later stages you were talking about.
Yeah.
So yeah, I think we spoke a lot about myopia. What are the other problems you see in kids in your practice nowadays?
Yeah, so kids, I would say, apart from which one you want to focus on?
Anything apart from myopia is that you see, probably
Okay.
astigmatism and
Okay, yeah. So in children, recently we have seen increase. There is one type of refractive error we call astigmatism, okay, or a cylindrical number. And last few years, we are seeing there is sudden increase in children having this cylindrical error. And the bad thing about it is that if it is stable, it's fine, no problem. Most of these astigmatic errors, they remain same lifelong, they have to be static. But if they are progressing, that's a bad sign, because that may indicate the child is developing a disease called keratoconus. And we have, again, like I said about myopia, that last few years we have seen increased incidence of myopia. We are seeing even increased incidence of this keratoconus. And again, it might be related to the increased screen usage, increased allergic tendencies in children. So they tend to rub their eyes, with that the incidence of keratoconus is also increasing. And what this keratoconus does is that it thins out the cornea, it causes a bulge in the cornea, and if it progresses further, the vision even with specs goes down, and which is something bad. If with specs I am getting good vision, functionally I am not hampered, but with keratoconus, even with specs, you may not be see clearly. And that is, I think, one of the things that the children or everyone should remember, that if they go to a spectacle checkup and with spectacles they are not able to see clearly, okay, this can be a sign of keratoconus in early age, and it has to be well checked by optometrist or ophthalmologist.
Okay, so even with the specs, if I can't see properly, that might be keratoconus.
Yes.
So it is sight threatening like myopia as well.
Yes.
And is there a treatment that you can offer to your patients if they have keratoconus?
Yeah, keratoconus can be same like myopia. It can be easily halted by a treatment called C3R, okay, which we are doing routinely for these patients. And good thing is that it stabilizes the disease, which otherwise is progressive. So it will go to higher number and reduction in vision, which we are halting. And apart from that, we have got specialty contact lenses to correct whatever the error is and make the vision crisp as it was before. And in certain cases, we can also offer certain lasers or intraocular phakic lenses, which can correct these refractive errors as well. So there are various treatment modalities available, which we can decide based on case to case basis.
I would like to thank you for giving us hope in both terms of myopia and keratoconus,
Yes.
because there are treatment options and people will be able to see properly and have a good life at the later stages. When we are again going back to our school, I love that discussion that you started off. So going back to our school, we also saw people with squints and binocular vision and all of those things, right? Is it still prevalent today? Do we still see kids with those?
Yeah, children have it. Good thing is that probably the awareness has improved. Of course, still it's not 100%, but we are seeing these children earlier and earlier. And just like other diseases, I think squint is something which we can treat quite easily. And I would say that no parent should stop treatment for squint just because they are afraid that something will happen to their eyes. Squint can be easily treated either by spectacles or by surgeries. We can treat them completely and for lifelong. And that is something, because see, squint is basically when the both eyes are not aligned. So child is not going to see anything binocularly. So if you are enjoying the 3D movies, remember, if the child has a squint, not going to enjoy.
Oh.
Okay. So why not correct it as early as possible, so that the child can see and these 3D stuff, and also the three-dimensional things or the assessment or the the ability is very important for fine work also. So if the child's three-dimensional visualization affected, it might be hampering some of his even the career options in future.
Well, as a very experienced and practicing ophthalmologist, I could not resist myself from asking you this question. You said about hand movements and all.
Yes.
Like when a child is born and the child is growing up, do you suggest some activities which really helps them in getting these movements and the eye and hand coordination? Anything that you suggest them on those?
Yeah, so I think our traditional, so many traditional these toys are there, and nowadays there are many activities which are done by the children. Nowadays, of course, we have nurseries, play groups where they promote these mobility exercises and fine hand movements and everything. So I think of course children learn on their own a lot. So if we just keep them away from screens, they will use their hands and feet a lot, and they will learn so many motor skills as well as sensory skills. So I think screen is something we should avoid in order to allow the natural ability of the children to grow.
So go out and play again.
Yeah, again, that's the thing. Yeah.
Right. So, okay, now because your is a super specialty and multi-specialty hospital, let's just move from children to adults. What are the common errors that you see in adults nowadays?
Yeah, so I think we have already discussed a lot about refractive errors. I think that remains the common error all across the age. But in adults particularly, cataract is something which is very, very common, particularly as we age. Our eyes also age, the lens ages, and that's how we get cataract. So cataract basically is not a disease per se, it's a aging process. Just like sometimes we get white hair or we lose hair, same way the lens sometimes loses its transparency, and that's what we call cataract. Cataract is very, very common, and particularly in India, because we are so close to equator, we are blessed with so much of sunlight. So obviously we start, that aging process starts early, we get cataract quite often. The second common, which is a hidden disease, I would say, is glaucoma. So glaucoma is basically raised intraocular pressure. That means eye also has its own pressure. It has nothing to do with the blood pressure. Eye has its own pressure. When it increases, it causes pressure on the optic nerve, that is the nerve inside the eye, and that causes reduction first in the peripheral field, and then it comes to the central field. So this is called glaucoma. Glaucoma comes in various forms, and the bad or worst part of it is it's a hidden disease. That means unless the patient gets almost say 90% loss of vision with glaucoma, patient will not realize that patient has glaucoma, because the peripheral field is lost, which we don't use often, and when the central field is lost, that's almost like 90% field is already lost. So for that, as we initially mentioned, annual checkup. There is no there is no alternative for it, that for getting glaucoma detected as early as possible, we should get annual checkup done. And almost like 2 to 3% of the population have glaucoma, and it remains undetected till the age and it becomes severe. So I think for that we have to do annual checkup. Okay. The third important thing, which is rising rapidly, like we talked about myopia in children, epidemic, like many children, 20-30% children are getting this. Similarly in adults, diabetes is increasing in epidemic proportions. That 20-30% of the adult population is getting diabetes nowadays, or pre-diabetic they are. And with diabetes comes eye disease, we call it diabetic retinopathy. So unfortunately, if you have diabetes, you have a very high likelihood of getting diabetic retinopathy, even if you are fully controlled. Okay, even if you are fully controlled, of course the chances of progressive diabetic retinopathy are reduced, but they are not zero. So if you are a diabetic, and even if you are in good control, even if you have good vision, that doesn't mean you don't have diabetic retinopathy. You have to get your eye checked, get your retina checked, and understand whether you have a retinopathy or not, because again, like cataract, glaucoma, we can treat diabetic retinopathy when detected early at right stage. We can almost 100% stop it from progressing. So I think these three are most common diseases in adults that we see. I left out a very common disease, but it's not threatening, but quite troubling, is dry eyes. Yes. Okay, so dry eyes is something which is happening very, very common. In fact, I would say that if the patient doesn't have these first three diseases, usually patient come to us because they have dry eyes, and that is probably every alternate patient that comes to me. Either if he doesn't have cataract, glaucoma, or diabetic retinopathy, usually they have dry eyes. Okay, dryness is increasing in epidemic proportion, and the primary concern is again the same, the use of screens, mobiles, desktop, laptops, everything. And you will say that you will see that most of the adults, young adults even, they are on screen for sometimes 14 hours, 15 hours, they jump from desktop to mobile, then OTT is there to watch all the entertainment and everything. So lot of time is given for the screen, and that causes reduced blinking, reduce tears, reduce the oil part of the tears, and leads to typically what there is a lot of fatigue of eyes. There is difficulty in opening the eyes probably in the morning. By evening it becomes red, itchy. You feel like taking a nap often. You feel like rubbing your eyes often. That's because of dryness, and that is something increasing quite often. So I think we come back from children to adults with the same, that overuse of screen is
Overuse of
causing a
screen.
lot of
Yeah.
things.
So stay away from screen. I think, whatever age you are of, please stay away from screen because that is very important, like Dr. Saurav just told us about. Uh, so dry eye is very common, and then you also spoke about cataract. And I have seen a lot of people very much afraid of cataract, even in my own family.
Yeah.
It's a cataract surgery. We don't know what is going to happen to our eyes, and I don't know how many days I'm going to get admitted, and whether I'm going to get my vision back or not. What is your idea? What would you like to tell to patients about it? Because you are living with cataract day in and day out, right?
Yes.
So how do you deal with that in this patient who have fear of getting a surgery done into their eyes?
Yeah. So obviously, if you get some problem and you have to undergo a surgery, you feel, of course, you are little bit anxious about the whole thing. But I would say that, if you see all surgeries in not just ophthalmology but entire body, all types of surgeries, cataract surgery is considered as most successful surgery of all. The results are like 99.9%.
Oh.
There are hardly any cases where I would say the surgery has failed. Very, very, very rare thing, unlike other surgeries that we undergo. So that is something we can be assured of, that it is one of the safest surgery to undergo. In terms of stay in the hospital, it's a daycare surgery. You
Oh.
don't have to stay in the hospital. You come for admission, just eyes are dilated, few drops are put. You undergo the surgery. The surgery, usually a good surgeon can do it in 10 to 15 minutes.
Oh.
Okay, and after maybe an hour or so, you are discharged from the hospital, and probably you will be back to work in 5 to 7 days. Okay, so the maximum precautions are taken in the initial 5 days. After that, you can start doing your regular work. And bonus to that is that your vision might be even more improved than you had earlier.
Oh,
okay, not
okay.
even when you didn't have cataract. Sometimes nowadays a lot of options are available, so that we can give you much crisper vision than even when what you had in your young days. These are the kind of things which are available with cataract. We are now getting new machines, safe technology. We have laser assisted surgeries, which makes this entire procedure quite comfortable for the patient with very good results.
So, and many a times I've seen people in my family says in winter only we'll get cataract surgery done.
Yeah.
It is not to be done in the summers or something like that. Is it just a mindset, or do you think
Yeah,
it's
it's
a
a
seasonal one?
mindset. So as I said, the post-operative care is just 5 days. Okay, so it doesn't matter, and you are staying at home. So at home, it doesn't matter whether it is a winter or summer. It's going to be the same, and there is no change in healing process or anything in winter or summer that we have noted. So I think it's you have to get operated basically based on doctor's recommendation and then your convenience at home. These are enough. You don't have to think about the summer or winter or what season is going on. That's immaterial from surgery point of view.
So whenever you are detected with cataract, get your surgery done irrespective of the season, because what I learned from Dr. Saurav is it is one of the safest, and it is also one of the most successful surgeries in terms of
Yeah.
any surgeries in the world.
Yeah, so see, basically, if after the surgery you are going to get a very good quality of vision, and some of the implant that we are using can get rid of glasses, spectacles also for you for distance as well as near. So if you are delaying surgery by 6 months, a year, apart from the fact that the cataract is going to be more and more mature, causing more problems, you are losing that 6 months or 1 year of good vision. Okay, why to unnecessarily have a bad vision for extended period when it can be treated early? So that's why most of my patients who delay the surgery, and when they get themselves operated, the first thing they say that I should have get it done a year back. I don't know why I waited so long. That's the common expression that they have afterwards.
No, thank you for that. That's a great insight. Get it done as soon as possible. And the other thing you said me was about glaucoma, and it starts affecting your vision
Yeah.
from the side, so we don't know about it.
Yes.
And till it's too late. So an annual eye checkup is very important.
Yes.
And how what is the process of the treatment? How long does it take?
Yeah.
If you can tell us something about that.
Yes, so the glaucoma can be treated either by just drops, eye drops which we put. there are surgeries and lasers available to treat that. So, we decide on which treatment to follow based on the stage at which the patient presents to us, and most of these treatments are successful, but of course, these patients require a good regular follow up. So, even if we start treatment now, that does not mean that patient should not come back and the patient is cured completely, because it is a progressive disease, age related progression is seen. So, at least every 3 months, 6 months, patient should visit the doctor, check the eyes, eye pressure, get the perimetry OCT test done, so that we know that it is not progressing and static. As I told that detection is difficult in early stages, same way the progression is also not easily detected unless you get the eye test done.
No, I think many of us normally don't know about eye pressure at all. We know about our blood pressure because
Yes.
that gets done regularly. And you said blood pressure and eye pressure are completely different.
Yeah.
So next time when it is it a good idea that when we walk into a multi-speciality hospital like yours, we ask for an eye pressure kind of a thing
Yes,
to be
yes,
done?
yes. So, if you are visiting any eye specialist, obviously the eye specialist will check eye pressure, and you can just ask him. If you are more curious, the doctor will also tell you more things, how you can take care and how you should follow up regularly.
And does it has a range like our body's blood pressure as well? Like blood pressure
Yes,
has a
so
range?
generally we consider 10 to 21 as a normal range, but of course it's not the only criteria for diagnosing glaucoma. The doctor will also check the optic nerve to consider that whether we should go ahead with additional testings or not.
And then you said diabetic retinopathy. So this is something which I was thinking in my head that if somebody has diabetes, even if they don't have specs, they should visit an eye hospital.
Yes, yes,
Because it might have affected their back of their eye, which they're not aware of, because
yes.
it does not affect their vision. So as soon as we turn diabetes, from that day onward, we should start doing an eye checkup. Am I
Yes.
correct in saying that?
Correct. Every year you have
Every
to
year.
get the eye checked, and I have seen patients treated in our hospital maybe 20, 30 years back with lasers, and they are still doing very well. Okay. So, if treated at right time, I think we can prevent probable blindness from in these patients. So, I think that that is something which every diabetic patient should know, that they have a high risk of blindness, but it can be completely prevented. Okay, so there is something which we can prevent and something which is as dangerous as complete blindness. So why shouldn't we get every year one annual checkup?
Yes. And I was completely unaware that even if the diabetes has just set in or the diabetes is under control, we should still get a comprehensive eye checkup done every year. That's a great insight. And we spoke how difficult it is to treat dry eyes, or is it easy?
Yeah, dry is again, see, whenever there is a problem, there is a solution which is rising, right? So, solution for dry eyes is, first the solution is eye drops, that you put lubricating drops, but that just probably is a symptomatic treatment, I would say. But nowadays we do many tests on the tear film, we call it tear film analysis and lid margin analysis, and then we detect what type of dryness the patient has, and accordingly there are many other treatments, many other medicines apart from just lubricating drops. We also have IPL therapy, which treats the Meibomian gland disease, which is basically causing less oil in your tears. So there are many other modalities. So once you go into detail, like what the patient has, what type of dryness, we can treat these with medicines or IPL therapy or certain lifestyle measures such as just warm compression on your eyelids. All this we can treat and cure dry eyes.
So what I learned from you is if my eyes are turning red, itchy, I should get to a practitioner as soon as possible so that they can detect and diagnose whether I have a dry eye or not.
Yes.
I always had a question I wanted to ask an eye doctor was about Lasik, because there are so many literature about Lasik. When I
Yeah.
Google it, is it safe? Is it not safe? Some article says it's very safe. Some article says it's not safe. Then they talk about power, that this power range it is safe, that power range it is not safe. It's very difficult for a layman to understand. So what would you like to tell our listeners about Lasik?
Yeah, so whenever there is a problem, as I was saying, there will be a solution to it. So first thing you have to understand what problem you have with specs. Okay, are you not comfortable wearing specs? Do you want to get rid of specs because of probably your job, or your personality doesn't suit use of spectacles, or your certain hobbies like probably swimming and some have some adventurous sports also as their hobbies. That's why you are the spectacles are you are having difficulty wearing spectacles while doing that. If you have that need of getting rid of specs, definitely you can consult a eye doctor. Now there are various types of surgeries, lasers and IOLs lenses which are available for treating these refractive errors. We have to individually select what is best for that treatment. So many times people go on Google and search this type of Lasik or this type of, but I think best person to ask is your eye doctor, because once your eyes are checked, the doctor knows whether first thing is it safe to do the surgery, and if surgery is needed or surgery can be done, then which type of laser or IOL suits the patient best. So I think that is what I would recommend to all people who want to get rid of their spectacles.
With that, I had also Googled another topic, which is also again very misled onto the Google part, was contact lenses. Because there are so many videos where contact lenses are safe, and then there are so many videos which says contact lenses are not safe.
Yeah.
What is your take on it, sir?
Yeah. So see, as I said, almost 20% of the population will be requiring spectacles. So one option is to use spectacles. Okay, if they don't want to use spectacles for the reasons I mentioned, that it may be they want to have a profession which is in maybe media, where they don't want to be seen with spectacles, or it is hampering their day-to-day activities, then there are two options. Like, you can use contact lenses, because contact lenses are like spectacles, but they are invisible because nobody can see that you are wearing contact lenses. They are safe in terms that if they are used in a proper, with proper precautions, they are quite safe. You can use it for many years, I would say. But we must understand that whenever you are using contact lens, there is a certain time limit. Like, if the contact lens is something which is allowed for 8 hours in a day, you should restrict it to 8 hours in a day. You should not extend it further, because if it is extended further, you are going to deplete the oxygen which is going to the cornea. You should not wear and sleep with contact lenses, because again that is going to deplete oxygen to the cornea. You should not wear and go for a swim, because that may cause infection in your eyes. So if you are very good in taking right precautions while using contact lenses, you should use it. But also you should give certain days as contact lens free days, so that the cornea gets time to rejuvenate and you can use it more often afterwards. Yeah, I think contact lenses are safe, but you have to make sure that you don't overuse it and avoid all these things which of course your optometrist or doctor will tell you that these are something you should avoid.
So basically, if I want to summarize this in one sentence, both LASIK and contact lenses are safe only if you follow your practitioner's guideline.
Yes, yes.
We can conclude it like that on these two topics. That's great. One more thing that I keep on hearing, and my parents are as well, are presbyopic, and then they can't see the near, right? Is it normal for everybody to become presbyopic? Does everybody become presbyopic, or is it a disease? What is your?
So interestingly, yes, as you asked, like whether everyone will become presbyopic. Yes, most likely 100% of us are going to be presbyopic. Age might differ a bit. Okay. So some people start requiring the specs at 37 years of age, some require at 45, some blessed ones may require at 50 or plus, but everyone will ultimately require it. And the reason is that it's basically the accommodation power of our natural lens which is going down with time, and that's why we need near specs. So even if you don't require specs for distance, you never had specs, you may still after 40s, you may start feeling that I cannot focus well, I am starting getting this headache, brow aches, some even get neck pain while when they read a lot. That is the time when they should go for an eye checkup, because they might be requiring now these presbyopic specs to read for the near, either use mobile or read newspaper. These activities will require specs.
And my parents were told, and rather they're using now, is something which is called as a progressive spectacle lenses. What are those like? How do they work, and are they good to use?
Yeah, so the initial specs, when they came into market, they were only for distance, because in olden days when it was first I think used, probably people were not living much longer, okay. But of course now the longevity has increased, and of course the near work has increased. So now you have to have a spec which is for near, but what about people who require specs for distance also, okay. Now you cannot have two specs that okay, for watching television I will use this, and now I want to read, so I will use this while working in office. Now okay, I want to look at you and speak, I will use this. Now I want to look at the computer, I will use this. It's very difficult to, so you have to combine the distance as well as the near prescription. Now either you can do it in a manner which is done earlier, which is called bifocal. Bifocal is the upper part is for distance, and near you will see a hemicircular fashion or maybe a cross like executive fashion. There is a segment for near, which was the typical way. Now it has issues because ergonomically it's very difficult to use. If I have a bifocal and I have to look at say like a desktop, I have to go and see like this. It puts a lot of strain on your neck. So patient has this spine problem. So to avoid that, make it more ergonomic, we have progressive glasses where apart from the distance and near, there is an intermediate zone which is for distance at say 60 to 80 centimeters for watching something at hands distance, and it's a smooth transition rather than a kind of a sharp transition like in bifocal. So even while looking at the specs, you don't realize that the person is using a near spectacle, which is nowadays we need, because if you are using a bifocal, I know that you are 40 plus. So if somebody wants to hide their age, and all of us want to, so progressive of course looks better because you don't see that line in between. And from ergonomically, which is more important, it works better because you have smoother transition, you have more range of vision for the near and intermediate.
So progressive, like you are saying, it normally works like a natural eye. I can see everything distance, intermediate and near with that lenses.
Yes, but of course it requires some adaptation.
Adaptation time is required.
So that adaptation you have to discuss with your optometrist or doctor that how I should get adapted to it. I have a very good video on that, so we'll of course give a link to that also.
Yes.
Because it's very important. It's not what we call when we don't have the two near and distance spectacles in one, we call it a single vision spec. That means the entire area of spectacles is for distance. So you look at everything, it looks same. You move your eyes, it looks same. In progressive, there are zones. So there will be a zone for distance, there will be zone for intermediate and near. So at that time, you have to know how you should move your head and how you should move your eyes. That is something you have to learn. So it takes around 5 to 10 days. Some people require little bit more time. But if you have got a good progressive design, good frame you have selected, you will get adapted to it. And once you get adapted it, it's I would say it's very, very good for your overall work, because you don't have to depend on multiple specs. You have a very good looking specs. That means you don't see that line in between. There is no sudden jump. And even as the power increases, because you are adapted to this progressive, you can see the intermediate and near very easily. So you don't have to have difficulty later for intermediate vision.
That's interesting. And many a times I myself am confused for my parents, or even for kids. What are the 3 things or 4 things we should keep in mind when choosing an eyewear, a complete spectacle, and the frame and the lenses together? What should we keep in mind when we are choosing eyewear for ourselves?
Yeah, so the fashion apart, of course, when we go to a spectacle shop, we look at something which looks nice. Of course, that is also important. But the frame should suit your face as well. So we call IPD, or interpupillary distance, which is the distance between our two center of the eyes. So that has to fit perfectly with your frames. If your frame is too small or too big, it might affect the centration of the lenses when you are using, and that may give rise to subnormal vision with specs, and you might have more problems like you might have more fatigue or headache when you are using specs. So frame should be proper, which is according to your face. That is something we must this thing. Even the size of the glasses, sometimes we go for fashionable purpose, we go for very small size of the glass, which sometimes is very difficult, particularly if you are using progressives. So I think it's best to ask the optometrist, if that particular frame fits properly considering the prescription that has been given, and that should be the first priority, because seeing clearly and without any efforts is something which we must look into first. And you will get lot of varieties nowadays. So even in the frames which suit you, you will get lot of varieties.
And anything I should keep in mind while choosing lenses?
Yeah, so as I said, if you are using only the distance, so you don't have near specs at present, you have lot of filters nowadays which are available. So anti-reflective coating is something which I would definitely recommend, because it reduces those glares. And nowadays we are using so many lights even inside the home and outside, so those glares are reduced by this anti-reflective coating. Even when you are photographed nowadays, because of social media we get photographed a lot, so you don't want those glasses to show the reflection a lot. So these anti-reflective coatings are really useful. There are some new things like blue filter specs which are also there, blue blocker glasses. Now the science doesn't show any proper evidence that it's going to safeguard your eyes against everything which comes out of screen, but I have seen few patients who are comfortable with these glasses, so you can use it, there is no harm. It has slightly yellowish tint, so if you are into a job where these shades of colors matter a lot, then probably you should not go for a blue filter specs. Anti-reflective coating doesn't have any color of the glass, so you can go for that. In terms of progressive, when you go for a progressive spectacle, I would advise you to go for a wider transition progressives, because I know they are little costlier, but adaptation is much easier with wider the transition, because then you get more zone in the glass where through which you can see the distance and near. In narrow transition you get very narrow zones, and in that case sometimes if you are first time user of progressive, you might get difficulty in adaptation. And I have seen many patients that once they have difficulty, they just stop using progressives and they just continue to use bifocal glasses. So I think wider transition zone, you can ask your optometrist or optician that I want to go for that. That will help you in better adaptation initially.
So one thing I take out from this discussion is talk to the optometrist and optician
Yes.
for what best suits your needs in life.
Right.
One last question on specs. I was just going through your OPD and I saw a few kids with patches like pirates on their
Yeah.
eyes. What's that?
So that is a occlusion treatment which we give for amblyopia. In I would say our local language we call it lazy eye. Okay. So lazy eye in medical terms is amblyopia, where one eye is not working as well as the other eye, despite having normal ocular structure. Okay. So most common cause is probably the as we initially told, that the refractive error was not detected at early age, and because one eye has a different refractive error and other eye has different refractive error, one eye is chosen by the brain to to see, and the other eye is kind of suppressed. So that's what we call lazy eye. And to as a treatment for that, we use these patches which is called occlusion therapy, where the good eye is patched for certain time, either hours or days, so that the lazy eye takes over and starts functioning better. Of course, there are now many other treatments which are available. We call they can be grouped under vision therapy, where it's not just patching, but we also give them some visually intense tasks and which they have to perform, and that causes rapid treatment of these amblyopia, as well as various ocular motility disorders, the muscle imbalance and everything, which can be treated by this vision therapy. Nowadays even the sports persons, they because they have to react very fast to moving objects, or they have to judge the distance they undergo vision therapy quite a lot to improve their reflexes, have more precision, so that they can do better in their games and sports.
Oh, wow. So if I'm a sports person, I should at least opt for one vision therapy counseling to see.
And you will read about it, even big cricketers, our players, hockey players, and they undergo this therapy quite a lot for not because they have problems, but to improve their visual performance.
Oh, wow. That's good to know. And thank you for enlightening us on the eye care part. And knowing you for quite a few years now, what I also wanted to ask you was, what will be your life advice for our listeners? Because probably our listener will encompass all age category.
Yeah.
So what will be your life advice for our listeners?
I think the most important thing which I find, when people of different age group come to us and have some diseases, I think one thing they disregard is their general health. Okay, if they have healthy habits, do regular exercise every day. They have to go and exercise, have proper diet. I think many diseases can be reduced, or at least their treatment, effect can be improved by just having good general healthy lifestyle and daily exercises. I think that is one thing I must tell everyone. Ocular health is part of general health. So if your general health is better, your ocular health is going to be better.
So live a healthy life.
Yes.
And you also told me that that's good for kids as well.
Yes.
That's good for adults as well.
Everyone.
So the entire family should work out, right? Thank you so much, sir, for your time. Thank you so much for taking out your time and enlightening us with all of these inputs that you told about our eyes, and helped us to keep our eyes in a much more better shape, and also to keep ourselves in better shape as well. Yes. So thank you so much, sir, for this.
Thank you, Rupam.
Really appreciate
I think it was nice interaction. I hope the audience will definitely enjoy it.